Hi, my name is Sarah Cassidy, and today I'm going to be talking about epinephrine. The IUPAC name for epinephrine is 4,1-1-hydroxy-2-methylaminoethylbenzene 1,2-diol. It has a molecular formula of C9H13NO3. The common name for this molecule is epinephrine, or it is sometimes referred to as adrenaline. Here I also have an image of the molecule itself, and going forward, I'm going to be referring to the molecule as epinephrine. There are a variety of functional groups in this molecule, including a methyl group, an amino group, a hydroxyl group, and a benzene diol group, which is a benzene ring with two hydroxyl groups attached to it. In the next slide, I have each one circled. So here we see the epinephrine molecule, and each functional group is highlighted and marked. From left to right, we have our benzene diol group, then our hydroxyl group, then a carbon attached to an amino group, and finally ending with a methyl group. Epinephrine is a chiral molecule. I have marked the chiral center with a dot and have the arrow pointing towards the chiral center. The priority groups in this molecule are the hydroxyl group, the carbon which is attached to the amino group, the benzene ring attached to the hydroxyl group, and also not pictured is the hydrogen, which would be going away from us based on the wedge structure of the hydroxyl group. I have listed the priority groups and their corresponding numbers here, as well as placed the numbers on the image. The numbers are going clockwise, so we have a right-handed configuration here. So I have labeled it R epinephrine. Epinephrine is an enantiomer, so it's a molecule that has a non-superimposable mirror image of itself. On the left of this slide, I have images of the two enantiomers. The top is the right-handed version and the bottom is the left-handed version. With my research, I had a hard time finding a constitutional isomer since the most prevalent one is epinephrine. I did find one called norepinephrine, which is a metabolite of norepinephrine, which is a vasopressor that is excreted in the urine and found in certain tissues. It is a marker for tumors. The intended uses for epinephrine include life-saving treatment. As an ICU nurse, I often work with epinephrine. An EpiPen, which is the middle image, is used as an intramuscular injection for allergic or anaphylactic reactions. It can also be used as a vasopressor, as either a continuous IV infusion or an IV push medication for the treatment of hypotension or low blood pressure. When someone goes into cardiac arrest, one of the medications given is epinephrine, and this is our medication of choice because it has a positive effects on the blood pressure and heart rate. The syringe we give is the first image. Another use is post-extubation. If a patient has stridor or laryngeal edema, we can give nebulized racemic epinephrine to help reduce the swelling in the airways, which is shown in our final image. And finally here, I have the works cited page. Thank you.